My name's Karen Zhang. I'm the Senior Vice President for a new department called Population Health Transformation. Population health really gets at the notion that it takes a village to support our patients and to improve community health. Medical care is incredibly important, but about 80% of the determinants of health have to do with where we live, work, worship, and play. And so social, behavioral, environmental, economic factors all deeply impact our health. We have patients who do not have reliable access to nutritious, affordable foods, who have great challenges and barriers to accessing transportation to be able to get to their medical care. And we also have patients who have not been empowered and supported in digesting some of the information that's critical to sort of self-management of their clinical condition, and that's what we call health literacy. A specific example I'll give you is transportation barriers being one of those really profound social barriers for our patients. That can take many forms. In our hospitals, on the inpatient side, an expanded transportation benefit and addressing the barrier is really about getting the patient discharged from the hospital in the most time-effective manner. You often can find a patient who is doing well, ready for discharge, 10 a.m. in the morning, and because, like so many of us, relying on a family member, a cousin, it may be not until 7 or 8 o'clock after that family member's shift that the patient can procure his or her own ride home. Now, from a county perspective, from our public sector perspective, having that bed occupied for 9, 10, 11 hours is a lot more expensive than partnering with forward-thinking technology approaches, Lyft, Uber Health, and to invest in a $15 ride home. In our ambulatory space, in terms of primary care and our clinics, oftentimes transportation is about getting the patient into the clinic. That's great from a quality perspective because it's continuity of care. When your no-show rate in a certain specialty, because of the patient's transportation barriers, hovers around 40% no-show, maybe 50% no-show, that's not good for the patient from a quality perspective in accessing care, and it's not good for the county pocketbook in terms of being efficient with our resources and our specialists. Harris Health's fundamental mission is to serve those who are most vulnerable in our community in the most effective way possible. So I'm incredibly excited to have the opportunity to help serve and to help build a more global approach towards health and to bring together different sectors that are incredibly important to our patients and our communities and build a more effective way forward.